Hey everyone, and welcome to this explainer. All right, let's just jump right into it, shall we? We're looking at the 12/80 blood pressure lie. And listen, this could fundamentally change how you, or maybe your parents or loved ones, manage health in your golden years. Seriously, if you're over the age of 70 and your doctor just, high-fived you or threw a little celebration in the clinic for getting your blood pressure down to that perfect textbook number of 120/80, I literally need you to stop whatever you're doing and listen very, very closely. Because that so-called perfect number, it might actually be the absolute most dangerous thing sitting in your medical chart right now. For decades, right, we've been conditioned to believe that lower is always better, that 120/80 is the holy grail of heart health, completely regardless of how many candles are on your birthday cake. But the latest medical data, it's telling a completely different, frankly shocking story.
And we aren't just talking about some small, isolated study here. Look at this number. 28%. A massive, comprehensive study involving 15,000 seniors was conducted to see what actually happens when older adults hit that textbook-perfect blood pressure. The results? It's wild. Those who were forced down to 120/80 had a 28% higher risk of serious, life-altering falls. And get this, they actually had worse overall mortality rates than seniors who were just walking around with moderately higher numbers. Just think about that for a second. The exact treatment designed to extend their lives and protect them, it was literally putting them at a nearly 30% greater risk of a catastrophic physical event. No way, right? So, this brings us to what I like to call the gold star trap. We've all seen this scenario play out, or, maybe you've even lived it yourself. You go into the clinic for your standard checkup. The nurse takes your reading, and it comes back at, let's just say, 145/86. Instantly, the doctor's brow furrows, they reach for the prescription pad, and boom, they put you on a new medication or up your current dose. Fast forward 6 months, you come back in, and voila, your numbers are 124/78. The doctor smiles, you get this metaphorical gold star on your chart, and everyone in the room thinks it's this massive success story. But here's the catch. This little celebration completely ignores the real-world consequences of artificially forcing that number down in an aging body.
Let's look at the hidden danger that standard medical guidelines often just completely leave out. In the brightly lit clinic, perfectly rested, sitting in a chair, your reading is that celebrated 124/78. But what happens at 2 in the morning when that same senior wakes up and needs to go to the bathroom? They stand up quickly. Because of those strong medications, their blood pressure drastically plummets to something like 88/56. Suddenly, the room starts spinning. They reach for the wall, but it's too late. At this exact moment, you guys, we are no longer talking about a harmless little number on a piece of paper. We're suddenly talking about a fractured hip, emergency surgery, weeks of grueling rehab, and a potential permanent loss of independence. All because of a clinic reading that looked good on paper.
Now, this crucial point is actually backed up by some of the most respected medical literature in the whole world. Consider the findings from JAMA Internal Medicine. That's the Journal of the American Medical Association. I know this is super counterintuitive to everything we've ever been taught, but the research is incredibly clear here. Seniors with a systolic pressure, that's the top number, sitting between 130 and 145 actually lived longer, and they had better cognitive function than those whose pressure was forced below 120. Let me just repeat that because it's a huge paradigm shift. A slightly higher blood pressure actually improves longevity and brain function in older adults. It protects them. Being perfect by the old standards is actually a hazard.
Section 1. Why your system changes. The biology. So, you're probably sitting there wondering, how can this be? Why is 120/80 suddenly a lie after age 70? Well, to really understand this, we've got to look under the hood at the biology. We have to accept a simple, undeniable physiological fact. Your cardiovascular system at age 75 is fundamentally, mechanically different than it was when you were 45. You just cannot apply a 45-year-old's biological standards to a 75-year-old's body and expect the same results.
To really grasp this, I want you to picture something. Think of your arteries at age 45 like a brand new, green, highly flexible garden hose. When water, or, in this case blood, pumps through it, the hose naturally expands and easily absorbs the pressure. It's stretchy. Now think about age 75. Your arteries are more like an old, stiff, sun-baked garden hose that's been sitting out in the yard for a couple of decades. It's lost its stretch, it's rigid, so when the heart pumps blood through these aging vessels, they just don't yield or expand the way they used to.
The official medical term for this is arteriosclerosis. And hey, it is the completely natural loss of arterial elasticity as you age. It literally happens to everyone. Because these stiff, sun-baked arteries can no longer absorb and distribute the pressure waves from your heart easily, your body makes this incredibly brilliant compensatory adjustment.
It actually requires a higher baseline pressure just to do its basic daily job. Your heart has to pump a bit harder, creating a higher pressure, just to push that blood against gravity all the way up to your brain and all the way down to your kidneys. If you artificially lower that pressure to 120, you're basically robbing the brain and kidneys of the force they need to receive adequate blood flow through those stiff pipes. Now, before we go any further, I actually want to hear from you directly. Go down to the comments right now and drop your age. Seriously, do it. This information applies very differently whether you're 65, 75, or 85. And if you have ever stood up too fast and felt the room spin or your vision go dark, I want you to type the word dizzy next to your age. This isn't just some minor inconvenience to brush off. I want you to start framing this symptom as a crucial biological distress signal. It is literally your brain screaming that it isn't getting enough oxygen.
All right, let's dive into the second biological reason why that dizziness happens and why the 120/80 target completely fails seniors. Meet your baroreceptors. These are microscopic little sensors built right into your blood vessels, and their whole job is to constantly detect and react to pressure changes. When you're 30 years old and you stand up, gravity pulls your blood down. Your baroreceptors detect this in milliseconds, instantly telling your heart to beat faster and your vessels to constrict so you don't pass out. But as we age, these tiny sensors get a little sluggish. They take a few seconds too long to react. If your blood pressure is already artificially forced down to a quote-unquote perfect 120, and these sensors are slow to wake up when you stand, your brain is quite literally starved of oxygen for a few terrifying seconds.
And that brings us to the third biological factor, metabolism. It's all about why medications often wildly overperform in older adults. When a doctor writes a standard prescription, it's generally based on how a middle-aged body processes drugs. But as we age, our kidneys clear drugs out of the blood much slower. Our liver metabolism slows down significantly. So what does this mean? It means standard doses meant for a 50-year-old can stay circulating in a senior system for way too long. They stack up, pushing their blood pressure way down into the danger zone. The medicine is working, sure, but it's working way too well for far too long. This creates a really devastating chain reaction that I call the cascade effect. It starts off so innocently with step 1, aiming for that low blood pressure target just to get the gold star from the doctor. But that leads directly to step 2, dizziness upon standing, because those rigid arteries and slow sensors just can't compensate, which then triggers step 3, a severe fall in the home. And finally, the last awful domino falls, step 4, a total loss of independence due to a bad fracture. We have to realize that aggressively fixing a number on a medical monitor can completely break a patient's actual quality of life.
Section 2. Finding your sweet spot. Okay, so we know that 120/80 is often too low for seniors, and obviously something like 180/100 is way too high. So where exactly should you be? Let's take a look at the new, accurate blood pressure targets based on the absolute latest longevity research.
First off, just to really hammer home why we need this new target, consider this totally stark statistic, 14%. This is hard data that should shock pretty much everyone watching. Having a resting blood pressure below 120 results in a 14% higher mortality rate for seniors. Let that sink in for a second. Being in that traditionally perfect zone literally increases your chance of death by 14% compared to those in the slightly higher, optimized ranges we're about to cover. Mind-blowing, right?
Okay, go ahead and take a screenshot of this if you have to. Here are the new sweet spot targets broken down by age. If you're between 65 and 74, your ideal systolic, that's the top number, is actually between 130 and 140. If you're 75 to 84, it goes up slightly to 135 to 145. And if you are 85 or older, the sweet spot is actually 140 to 150. Why the increase? Because these specific, slightly elevated ranges provide ample protection for your heart against strokes while making absolutely sure there is enough biological force to keep your brain and your kidneys properly fed with oxygen-rich blood through those stiffening arteries.
Now, we also can't forget the bottom number, the diastolic target. It's super vital to note that this bottom number represents the pressure in your vessels when your heart is resting between beats. The latest guidelines suggest keeping this number above 65 to 70. If it drops too low, say down into the 50s, you actually risk not keeping the blood flowing adequately to the heart muscle itself. The heart needs to feed itself during that resting phase, and it absolutely needs a baseline pressure of at least 65 to do that effectively.
Section 3, the orthostatic home test. All right, this is where we take all this theory and put the power right back into your hands. This is the critical vital sign measurement test that you or your loved ones really need to do at home tonight. Your doctor probably isn't doing this in their rushed 15-minute clinic window, which is exactly why you have to protect yourself by doing it in your own living room.
Here is exactly how to do it. It's super simple. Step 1, lie completely flat and still on your bed for 5 whole minutes. Just breathe and let your body reach its absolute baseline. Step 2, while you are still lying down, go ahead and take your blood pressure and write that number down. Step 3, now here is the most important part. Stand up and hit the start button on your machine immediately. Literally, do not wait even a few seconds. You want to capture exactly what your pressure is doing the exact second gravity hits your system.
So what exactly are you looking for when you do this? Pay very close attention here. Compare your lying down number to your standing up number. If your top number, your systolic, drops by more than 20 points the moment you stand, or if your bottom number, your diastolic, drops by more than 10 points, these are massive, screaming red flags. If you see these specific drops on your home monitor, it is a glaring indicator that your medications might be dangerously strong or your baseline target is just set way too low for your unique body.
The precise medical term for this red flag is orthostatic hypotension. It literally means a sudden drop in blood pressure upon standing. I want you to memorize this exact term. Write it down in your home log right next to your numbers. By knowing this phrase, you are fully empowered to advocate for yourself. When you go to your next doctor's appointment, you don't just walk in and say, "Oh, I feel dizzy sometimes." No, you hand them your log and say, "Doctor, I am experiencing orthostatic hypotension and I believe my medication dose is too high." Boom, game changer.
And this brings us to our ultimate philosophy for today's explainer. We need to treat the patient, not the number. Applying a universal 120/80 guideline to every single older adult is exactly like buying one pair of size 8 shoes for an entire town. Sure, some people might fit them perfectly, but others are going to get terrible blisters, and some are literally going to trip and fall on their faces. Universal numbers just don't work for unique aging biology. You are a whole, complex person, not just a reading on a screen.
To wrap up this explainer, if our time together today has changed how you view your health, I want you to go down to the comments right now and proudly type the word informed. Declare your new confidence. Don't suffer in silence with dizziness or fatigue just because someone gave your chart a gold star. Schedule that appointment, bring your home orthostatic test log, and demand a target that actually fits your unique body. And please, hit the share button on this explainer and send it to just one person you know over the age of 60. You might just save them from a devastating fall. Stay curious, stay informed, and I will see you in the next explainer.